Good afternoon, everybody. Um, so today we are going to talk about the topic of malnutrition. So the specific learning objectives of this class is by the end of this session, you must be able to define malnutrition, describe the magnitude of the problem of malnutrition, explain the epidemiology, classify malnutrition and illustrate them in detail, and also discuss the preventive measures of malnutrition. Okay, first of all, what is malnutrition? We usually think that malnutrition means only undernutrition, but coming to the actual definition, it is defined as the pathological state resulting from relative or absolute deficiency or even excess of one or more essential nutrients. So either deficiency or excess, both would be uh, coming under the category of malnutrition. So it is like a double-edged sword. So there are two ends of this. Okay, at one end of this is the undernutrition, which is seen in different forms like marasmus, kwashiorkor. Okay, so and the other end is the obesity, or the overnutrition. So which is mainly seen in the rich and developed countries, whereas undernutrition is more prevalent in the uh, poor developing and underdeveloped countries. So both they are both ends of the malnutrition, so both ends of a sword. But usually in terms when we discuss, we usually term as undernutrition only. So malnutrition means undernutrition, but the actual definition would be seeming both the sides of it. Okay, so coming to the magnitude of the problem, so here we are speaking in terms of undernutrition. So when we see around the world, about one third, more than one third of the population is affected with this undernutrition problem. And when you look at the indicators of the PM, that is a protein energy malnutrition, most of them, when you look at the indicators, most of the children, they would be residing in this Asia, the continent of Asia, especially in the southern Asia. Most of the undernourished children are found. Okay, and even this malnutrition also contributes to about 45% of deaths among children who are less than 5 years of age. So the deaths, most of the deaths directly or indirectly, the causation would be undernutrition, and especially in the low and middle income countries, whereas in the high income countries the reasons could be a different cause. But usually in the low and middle income countries, almost half of them are due to this undernutrition problem. Okay, so this is the extent of the problem in the world. Whereas when we see now our own country, recently the 2020 Global Hunger Index report has been released. I don't know how many of you have watched it. So among that, India was ranked as 94 out of 107 countries. So you can see how backward our country is. So among 107 countries, India is standing at 94th place in terms of hunger. So that much. That in such a so it comes under the category of serious hunger category, which is a very worst scenario. Okay, so the score is also very less, that is 27.2. So when compared to the neighboring countries like Pakistan, Bangladesh, Myanmar, they are much more better than our India. Even Pakistan stands at about 88th place. So it's much more better than our country. And even Bangladesh and this Myanmar 75th, 78th place. If you look at the uh, uh, categories, you can know like this global hunger index. How do we calculate? This is calculated like every year. So we usually take the average of three different indicators. First one is the percentage of population who are undernourished, and the other one is the percentage of children who are underweight. So it includes both the stunting and wasting category of children. And another indicator is the percentage of underweight, under 5 mortality rate. So these three indicators are taken into count and divide it by 3. So when we do this, you get the score. So this score is from 0 to 100. So 0 means it's the best. Okay. Okay. If the global hunger index, the score is 0 means there is no hunger at all. That's very good. If it is 100 means it's the worst scenario. So in that way, our India is standing at 27.2, which comes under the category of serious hunger category. So in that report, it is given as 14% of India's population is undernourished, and among children under 5 years, 37.4% are stunted and 17.3 are wasted. So we'll just go through the, I'll talk in detail about what is stunting and wasting. So just remember this. And the under 5 mortality rate is 3.7%. So when you calculate all this together and divide by 3, you get the percentage of the score of 27.2. Okay, coming to the different states in our country. So Madhya Pradesh, Jharkhand, Bihar, and Chhattisgarh are the most worst affected states with the highest number of underweight children. And even Andhra Pradesh, when you look at the NFHS 4, the National Family Health Survey 4 results, in that it shows that 33.1% of the under 5 children are underweight, and 32.5% are stunted, and 17.8% are wasted. So these are the different uh, percentages which depict the present situation of malnutrition in our country and in our state. Okay, so talking about the epidemiology of malnutrition, just like any other disease, like for any communicable or non-communicable disease, we usually draw the triangle of epidemiology. So just for malnutrition also, we have like agent, host, and environment factors, which we'll be talking in detail. So agent factors, okay, the disease, okay, how it's usually due to the food diet, either it due to be quality or quantity, anything which is lacking. The food which we have talked about different kinds of nutrients which the human body requires, the macronutrients, the protein, fats, carbohydrates, or the micronutrients, the vitamins and minerals. If anything, any one is lacking and not uh, it's not well maintained, it's not given taken properly, it results in malnutrition. Okay, so the diet is very important. And breastfeeding, definitely, the children, the growing children, uh, immediately after birth, it's good to start the early breastfeeding within 1 hour of birth. And it's you have to, the breastfeeding must be continued exclusively for first 6 months of life, and after completing 6 months, the complementary feeds must be started. So anything, if any, if it is not happening in a proper way, the child may land up in malnutrition. Okay, so even the children who are bottle fed also, they have to be checked properly whether the formula feed which is being given is this given in proper proportions. If it is given in diluted milk or like that, also the baby will not be receiving the adequate nutrients and energy required for its growth and survival. Okay, so even the complementary feeding, the introduction of complementary feeding at after completing 6 months is equally important, because the first 5 years of life of any child is very, very important. Okay, next is fetal nutrition. Definitely, the mother. Am I audible? Can anybody please respond to me? Am I audible? Okay, okay. Thank you, thank you. Okay, I'll just start up. There's some power problem here. Okay. So, coming to the fetal nutrition, so definitely while the mother is pregnant with the baby, it's equally important to take good nutritious food so that the baby growing inside would be healthy and the mother would be delivering a optimum weight child, not like a low birth weight child. So, especially in the last trimester, the pregnant mother has to take adequate nutrition required for the growth of the baby. And not only that, even a undernourished child, girl child, if the girl is undernourished from birth onwards, she would be landing up as an undernourished pregnant mother, and again she would be again delivering a uh, undernourished baby. Okay, so like this is like a cycle. So if you see here, definitely the nutritional status of a pregnant mother is very important because that would have a impact on the lactating status. If she is uh, if she is well nourished, she's taking good amount of food, enough calories and proteins, she can give breast milk. Okay, then the baby which she gives birth would be healthy. So if it is a girl child, definitely she would be landing up in menses and everything. Again, she will be coping up with a lot of problems. And if that would be continuing, if she is a low birth weight girl, she would be again like stunted or wasted. She will be malnourished, and again she would be a malnourished mother when she is a when she becomes a woman of childbearing age, and again she would be a undernourished pregnant woman. So this would be a like a cycle. So we to curb the cycle in between, the the girl child, the nutrition status of her should be improved to cut off this cycle. Okay. Next, coming to the host factors. So, who are the people who are who are more at risk of developing this malnutrition? Who are the children or adults who are whatever? So, especially when you see the age, the less than 5 years of children are most commonly affected. Okay. And gender, again, a girl child made either due to gender discrimination or due to bias. So the girl child is usually neglected in a family. So most of the undernutrition is seen in, especially in the girl gender. Okay, and large family, definitely. If the family is very large, the the earning person cannot feed everybody. Like if they come from a good like socioeconomic status, it is okay. But when there are so many children, the mother cannot take care of each and every kid. She cannot give a proper care and nourishment to the all the children. So it's always good to have a small family, like two kids. Two kids are good. If the number of kids are more, it's not possible to take care of everybody to meet the nutritional requirements of all the children. So definitely, the families with who are having a large number of family members, they most some few, not all, but few cases may land up in malnutrition. Okay, and socioeconomic status, definitely. Poverty plays a very important role in the causation of malnutrition. So here we can see different kinds again. The in the rich families, we usually see the other end of the malnutrition, like the obesity or the nutrition we see. Whereas in the poor socioeconomic status family, this undernutrition is commonly seen. Okay, and termination of breastfeeding. So usually we advise the mothers to give breastfeeding till 2 years of age, but exclusively till 6 months of age. Okay, so if the breastfeeding is terminated either early or late, so both would be a problem. Some in some cases, what happens In some cases what happens is that some mothers, they usually continue the breastfeeding till 8th month. That is, they do not start the complementary feeding. Even that is also bad, because the exclusive breastfeeding is uh, uh, sufficient for the baby till 6 months of age only. But after 6 months of age, the requirement of the baby is increased. So definitely the complementary feeds must be started. It's good that if you continue the breastfeeding along with the complementary feeding, both should be given, but not only breastfeeding after 6 months of age. So even starting early is also early termination of the breastfeeding. That is, some mothers stop it at 4 months of age, saying that it's not good. Like, they have different cultural and traditional beliefs, some unscientific reasons. So that is also a very bad custom, which again, it's a cause for this malnutrition. Okay. Next, ignorance of the nutritional needs. So growing children, they require more amounts of energy, especially protein food are more important. So the mother who is taking care of children should be aware of the requirements of the children. So according to the growing age, the mother should be able to provide proper nutrition to the children. Okay. And faulty complementary feeding practices, definitely. Um as I told you, like after 6 months, you have to start the complementary feed. Some families, they do not start the complementary feeds after 6 months. They say that you have to start it at 9 months. So like that it happens, and they do not give the foods which are easily digestible for the child. Like, you have to start with soft, semi-solid foods like mashed banana, like mashed vegetables, like dal, cooked dal, like that. But the child rearing practices are also very very important, because the bringing up of a child is not so easy. Like, not because they may land up in undernutrition if the proper care and nutrition is not provided to them. Okay. And infections, definitely the malnutrition and infections are a vicious cycle. One would be leading on to the other. So if you look at this diagram, inadequate dietary intake, if the person does not take proper food either in quality or quantity, it would be landing up in weight loss, definitely. And the growth faltering occurs. The growth which has to be occur in a proper way will be halted, and the immunity system would be damaged. So the immunity will be lowered. He would be more prone to infections and mucosal damage. Definitely, the respiratory epithelium and the intestinal epithelium are more prone to it. So they would be the damage would be occurring to the mucosal epithelium, and they would be again prone to the infections like respiratory infections or diarrheas. So this would be landing up to disease. And the disease, the what kind of disease, the incidence, duration, and severity, how severe the disease would be uh, having a effect on the loss of appetite. Definitely, when there is disease, you cannot take proper food. When you get a small fever only, we cannot take food. So when the child lands up in any kind of infection, the child cannot take food. The appetite would be lost, and there would be loss of nutrients. Definitely, the intestine, the GIT also would be not be proper responding. So there may be malabsorption. So even if the food is properly taken, also it may not be completely absorbed, and the metabolism of the body is also altered. So this again would be leading to inadequate dietary intake. So the proper food will not be taken. So this is like a cycle which has to be altered. So the infections and malnutrition go hand by hand, and lead to the even malnutrition or even death of the child. Okay. So environmental factors, so this is also very very important. The environment in which the child is growing plays a very important role in the upbringing of the children. So physical environment, so the place in which he's living. So if the house in which he's having is overcrowded, or there is no ventilation, proper ventilation. You will be taking all the criteria, right? When you do the survey, you will take all the criteria for the physical environment. That there is supply of safe drinking water, sanitary facilities, hygiene, any open field, open defecation practices. So everything you will be asking, like the ventilation, lighting, everything you will be asking, or crowding, how many rooms, how many persons. So all these are also very important, because indirectly this would be resulting in infections, the respiratory infections, or due to unhygienic the practices, like having the open defecation or other unsafe, hygienic, not taking proper bath, and all this again would be leading to infections, and again it would be landing up in diseases. Okay, cultural environment, definitely. So different people have different states, or they will be practicing different cultures. So in one religion again it will be different, in another religion it will be different. So like so all these are play a very important role. So under the cultural environment we have different unscientific food habits, customs, beliefs and traditions. So the colostrum, which is usually the first breast milk which is given to the baby, that is very very rich in uh, it has good nutritional what do you say, the nutritional all the requirements. So but this cholesterol is discarded, saying that it's not good. So that is again a very disbelief. And the pregnant mother will not be fed properly, because if the pregnant mother is fed properly, she will become obese and she cannot give pains, and she may not give for it. The baby will be very high weight, and the mother cannot deliver. So that, like, so many disbeliefs are prevalent in different forms of the society. So this again would be playing a role in the causation of malnutrition. And even in pregnant mothers, so many even lactation also, like we can see in our day-to-day life, like you may be seeing in your own families also, like lactating mother, they have to be given good food, like more than when she's taking during pregnancy, she has to be given more food, because milk production should be adequate. But during the postnatal period, the mother would be given a very very less food, because she has to shed off the weight. So there are so many reasons for that. So these are the different disbeliefs which are prevalent in the society. And faulty cooking practices. So the cooking in the open pan, and discarding the water from rice while cooking. So these are all again different cooking practices which decrease the quality of the food which we are taking. And food related religious rituals, definitely we have so many fastings, like during festivals, like Muslims, they do a 40-day festival. So like even though we are having food, we do not take it. Like even some people follow vegetarian, like strict vegetarians, they do not take even egg or milk also. So that is again like they are prohibiting protein intake. So though they can afford, they can buy also, due to this religious customs and rituals, they are not taking. So this all would be coming under this category. And faulty child rearing practices. So the bringing up of a child, like already I've talked about it. So the child rearing practices are very important, like the feeding, taking care of the child has to be a pivotal role of the mother, especially because if she is not aware of all that, the child may, which mother is innocent or the ignorant about the bringing up the child may land up in malnutrition. Okay. And another one factor is the food production. So different countries, they have different modes of producing food. The food security is very important. So like recently we had the disasters, like the floods which have happened. So most many of the fields, the crops have been destroyed. So there is loss of food. Like though we are able to produce the food, that food is not being useful, because it has been lost due to either disasters, or it could be many other reasons, due to droughts or any time, like some other reasons. So the food production of the is also of the country or the state is very important, because the adequate food per capita, the per head, the requirement of the people has to be fulfilled. Okay. And the availability of basic health services, definitely, because especially the immunization services and the basic, like the primary healthcare services should be available, because uh, to protect them from diseases, as diseases, malnutrition is a cycle, vicious cycle. So indirectly, the environmental factors would be playing an important role in the causation of malnutrition. Okay. So coming to the classification of malnutrition, we have different categories here. So just I'll be naming them. We know, like, there is a Gomez classification and the Indian Academy of Pediatrics classification. This is based on only weight for age. So for this age, how much weight the child should be. Is the child growing in that way? So this is the indicator which they have taken. And another one is the WHO classification, where it's also called as NCH's classification, the National Center for Health Statistics. So here the median weight of the NCH's reference population is taken. So this is again considered a very best indicator which we can do internationally. For any country, we can use this classification to classify the child as having normal or malnourished or overnourished or whatever. And another one is water loss classification, where here weight and height, both categories are taken. And Wellcome's classification, where here weight for age and edema, both two indicators are taken. And mid upper arm circumference, I already talked about this in the last class. So this is only applicable for children between only 1 to 5 years. Okay. So any of this classification can be used for classifying malnutrition. Okay. So coming to the types of undernutrition, we have different categories right here. Like the first one is stunting is nothing but being short for one's age. So the person will not be growing in height, he will be very short. It's not like dwarfism, but this is dwarfism is due to genetic problems, but this is stunting is due to chronic malnutrition. The person is not having proper food. So due to this, the stunting is happening. So here the indicator is height for ages less than 2 standard deviation. Okay. Next is wasting, another one type of undernutrition. Here the child is good height. He's growing in height well, but there is loss of weight. So he is thin. So he's thin for his age and height. So this is mainly due to acute malnutrition. So here the category is weight for height you will be taking is less than 2 standard deviation. So here if you see in this diagram, so this is a normal child. So here wasting, the child is having like compared to normal child of his same age, he's having the same height, but he is not the build is affected here. He is thin when compared to the normal child. Here, if you see the stunted child, the build is okay, like but he is having very less height when you compare to the normal child. Okay, so this is the difference between stunting and wasting. Stunting means height is affected, and still chronic malnutrition, that is from since many years or months he's not taking good food. Okay, whereas wasting is due to acute malnutrition, that is maybe for few days or few months that person, either due to some illness or some surgery or whatever. So only since few days that person is not taking food, so that is why the child may land up in waste. Okay, so that is the difference between both of it. And another one is the underweight. So here the underweight child, if you see, like compared to normal child, he's having um little less height, and here the both the weight is also affected. Okay, so mainly for compared to the age, so the weight is especially affected here. So weight for age is taken here. Okay, not weight here. In wasting it is weight for height, but in underweight it is weight for age. So that is the very important difference between underweight and wasting. So underweight includes both acute and chronic malnutrition together, may happen the causation of this underweight. And another one is the micronutrient deficiency. We know that micronutrients is nothing but vitamins, minerals, any one deficiency is occurring. We call it as micronutrient deficiency, also called as hidden hunger. Okay, so these are the different types of undernutrition. So we have to also talk about the different categories of SAM and MAM. So what is SAM? What is MAM? This is not like some nicknames or anything, but SAM stands for severe acute malnutrition and MAM stands for moderate acute malnutrition. So if you see this child, so here he comes under the category of SAM, and then MAM, and here now he has completely regained his weight. He is healthy, happy. Okay, so these are like we'll just talk about this in detail. So coming to the differences between the SAM and MAM, which you have to know. So SAM is like most extreme and visible form of undernutrition. So just by seeing the child itself, you can tell that it's a SAM child. So here you can see like the first picture, the how the ribs are so prominent, how he's so thin, like the arms and all. You can see just by just mere look itself, you can identify the child. So that is a case of SAM. Whereas moderate acute malnutrition is like a wasting, like I told you, talked to you before. Uh, the only like the weight is affected. Okay, very less weight, but not like SAM. Less weight is affected. It's due to acute malnutrition, like moderate. So it is also comes under the category like wasting. Okay, so what are the different criteria for how can you classify child as SAM or MAM? What are the criteria? So for SAM, the criteria is he must be having very low weight for height or length. Okay, so it this here we have again a different distinctive thing, that is it should be less than 3 standard deviation of the median WHO growth standards. We compare it with the WHO growth standards. So whereas in MAM, here also there is low weight for height or length, but it is below 2 standard deviation, but greater than 3 standard deviation of the median WHO growth standards. Okay. Okay. So here you can see here it is less than 3 standard deviation. Here it is less than 2 standard deviation, but it is greater than 3 standard deviation. And mid upper arm circumference is less than 11.5 centimeters, and mid upper arm circumference is 11.5 to 12.5 centimeters. Okay. And here you in SAM you have bilateral pitting edema, nutritional edema. So these are all like and or either one should be present, not all need not be present. So most of them may be occurring together, but and or this can be happening. So bilateral pitting edema. So in the previous picture which I showed, you may not find edema because like it's a clear case of marasmic child. Like there are two categories of SAM again. We'll talk about it, marasmus and kwashiorkor. So it's like a bilateral pitting edema. So nutritional edema is seen, and visible severe wasting. Just by mere look, you can see that the child is having severe wasting. Okay, and whereas moderate acute malnutrition, the child is clinically well. So here you can see the child is okay, like not so ill. Just you can cover up like he looks clinically well, and he's also has a good appetite. Okay, so how do you manage the SAM child? Okay, how do you manage a SAM child? This SAM child requires immediate admission. You have to immediately admit the child to NRC, Nutritional Rehabilitation Center. Whereas MAM child, you can manage them at home by using supplementary nutrition or locally available foods. The intake of food, if it is improved in quality and quantity, the child can improve. And nutritional counseling is required for the mother. and management. So giving certain foods and everything is sufficient for this ma'am child. Okay. So again here we have different categories like marasmus and kwashiorkor, like the Sam child. So please have a look into the both the children. So you can just identify just by mere look. You can know who is a marasmic child and a kwashiorkor child. So the kwashiorkor child looks like normal child. He doesn't look like so abnormal because normal healthy like puffy children, they're like this itself. But you have to know the difference between kwashiorkor children and a normal child. And marasmic child is easily you can appreciate because there is visible severe wasting like the ribs and everything. You can see like how thin the arms and all the fat under them is lost. Okay, so we'll see the differences between both of them. So marasmus child is mostly the age of onset is less than 1 year of age, whereas kwashiorkor you can see in 1 to 5 years old. And severe muscle wasting is seen in marasmus, whereas in kwashiorkor the muscle wasting is very mild or absent. There may not be any kind of muscle wasting. And subcutaneous fat is totally lost. You saw the picture, like there is no fat at all. Completely, it's like skin on the bones. So here in kwashiorkor, the subcutaneous fat is retained. And marasmus child, you do not find any edema, and kwashiorkor is all edema. So the main difference between the normal child and the kwashiorkor, like he may be looking like plump and everything, but it is all because of edema. It's not like good muscle mass. It's not all of muscle mass, but it is mainly the water which is retained in the subcutaneous tissue. You have that plumpy look of the child. Okay. So marasmus child is he is a voracious feeder. If you give him food, he can take the food. Whereas in kwashiorkor, the appetite is poor. Even if you feed him also, the child will not be taking. So the appetite is very poor. He will not be taking in foods. Okay. Whereas in marasmus child, the skin is very loose. You saw like it's like a baggy pant appearance. I'll show you the pictures. So the baggy pant appearance, whereas in kwashiorkor the skin is there is flaky paint dermatosis. So there is patches of like due to the pigmentation of the skin, the edema, the skin is stretched and everything. So there is flaky paint dermatosis in kwashiorkor. And hair, when you look marasmus, there is usually no hair changes. Whereas in kwashiorkor, the hair is easily pluckable. Just by touching itself, the hair will be removed. And there is flag sign. I talked about this in the last class. There is alternating colors of uh, light and dark pigmentation because the melanin is lost from the hair. So because of the growth of the child, so the flag sign is seen in kwashiorkor. So marasmus is like the child is alert. He is alert but irritable. Okay. Whereas kwashiorkor is apathetic, like the person will not be responding to stimuli. Like he is very disturbed. Like you cannot interact with the child. Okay. Whereas marasmus child is he is alert, and if you give food, he can take. Though he is irritable, but if you give food, he can take. Whereas kwashiorkor child is completely apathetic. Okay, and it is not easy to feed him also. Okay, and another important thing is the serum albumin levels. Here, marasmic child, it is usually normal and there may be little decrease, but in kwashiorkor, it is very low. It is less than 3 gram per 100 ml of blood. Okay, so how do you manage this marasmic child? So definitely you have to replenish the child with both all the required nutrients like protein, carbohydrate, fat, and everything you have to give. Whereas kwashiorkor child, he requires mainly the only the protein intake. So this is the main differences between the marasmus and kwashiorkor. So these are the pictures. This is the flaky paint dermatosis which is seen in uh, marasmic child, and this is the flag sign when you see alternating low pigmentation and high pigmented hairs. And this is the baggy pant appearance of the marasmic child. So just like baggy pant, if you see how the folds you appear. So here also in the marasmic child, there is baggy pants due to the loosening. There is no fat. The buccal fat is completely lost, like the gluteus maximus and all the fat is completely lost. So you can see the folds of the skin as baggy pant appearance. So how do you prevent this? Malnutrition. So you have seen the different causes, different varieties of this malnutrition, like how you can prevent it. Like same, like we also follow this primary prevention, secondary prevention, tertiary prevention for this malnutrition also. So in the primary prevention, so before the malnutrition sets in, how can you do? You have to do the health promotion. So definitely, so while the child is still in the womb, or when the child is being grown, the pregnant and lactating mothers, they have to be educated. They have to be provided with iron supplements, folic acid supplements, and calcium supplements. So required for the growth of the baby. So they have to be provided with adequate food and nutrition. So the mother would be delivering a healthy weight baby. Okay, promotion of breastfeeding. So the whatever the disbeliefs, customs are being followed by the mothers, they have to be curbed, and the importance of breastfeeding should be the awareness must be created among the mothers. And development of low cost weaning foods. So at the time of weaning, like the complementary feedings, when you start after 6 months, they're usually very cost. Like if you know the we in markets, the Cerelac and everything are available. They're very cost. Like all the straight of the society may not be affording them. So low cost weaning fits, like at home prepared, like whatever they are preparing, the food, dal, that is again just use of ghee, adding of ghee and vegetables. So everyday use of vegetables, and making fruit purees, soft cooking the bananas, which are low cost when you compare to apple. You can use banana, which is of less cost. So the low cost weaning foods must be promoted. Okay, and the family diet should be improved. The family should be educated about the importance of taking good amount of food. And nutrition education, definitely what kinds of food to take, what kinds of food to avoid. Like the society must be created awareness about the importance of nutrition. Okay, and home economics, definitely the mother, the homemaker, whoever it is there, so she must be taught the home economics. Like home economics is nothing but when like a person earns in the family, like the head of the family, he will be earning. So how to manage the expenses, how much you have to give for food, how much you use for rent and other purposes. So how you have to give importance to the food. So that is the home economics. So in the home economics, the homemaker, the mother, whoever is taking care of the family, should be having a good idea, so that she can take care of the entire family's nutrition. Okay, and family planning and spacing of pets. As I told you, large families, they cannot take care of all the kids. Like it's difficult to take care of the kids. If they cannot provide care, if they have any diseases, they cannot afford to give them proper treatment and everything. So family planning and spacing of births is very important. And family environment. The family should be able to bring up the child in a nurturing way. So definitely the family plays a very important role in the bringing up of children, so that the child would be growing up in a healthy way. Okay, next is the specific protection. Under primary prevention, we also have specific protection, like how specifically we can uh, protect the child from malnutrition, like giving adequate protein and energy rich foods. Like growing children, they have to be provided with milk, eggs, fruits, vegetables, fresh fruits, vegetables, the non-vegetarian diet. So all this they have to be given more. And immunization to protect from the common diseases, the vaccine preventable diseases. And food fortification. So we have seen, like there are different deficiencies which are commonly seen in the nutritional problems, like iron deficiency anemia, iron deficiency disorders. So by using the food fortification, we can supplement the whole populations with the required supplements. Am I audible? There is current cut here. Am I audible? Can anybody respond? I'm audible? Okay, thank you. Okay, I'll continue the class. It's over, like just 5 minutes. So next, under the secondary prevention, we have the early diagnosis and treatment method. So how can you diagnose the malnutrition priorly? So there has to be periodic surveillance. You have to check the weight of the child, height of the child during the growth phase. So any lag in growth, by plotting them on growth charts and everything, you can identify the any lag in growth priorly and take necessary measures to overcome it. Okay, and definitely the infections like ARAs, the diarrheas, respiratory infections, and all that, they have to be diagnosed early and treated properly. And certain programs, like we have different national programs for different diseases, like simple measures like the ORS for treatment of diarrhea, and IMNCI for this ARA infection. So using like very minute without much knowledge, like the simple Anganwadi workers can do that. So that kind of programs has to be developed so that the infections, everything can be treated at the primary care level. And even during epidemics, so during epidemics when there is disease, there is urgent diseases, the supplementary feeding programs has to be carried out, especially to the growing children, the pregnant mothers, lactating mothers, which have to be uh, they have to be prioritized. Okay, and deworming, definitely the worm infestations, they are very common, like the hookworm infections, which are mainly in the causation of iron deficiency anemia. So periodic deworming, like once in 6 months, is very important to uh, curb that. Okay, and last one is the tertiary prevention. What to do when you already the malnutrition has occurred? So already the child is suffering from malnutrition. What can you do? You can nothing do but rehabilitate the child. So we have like nutrition rehabilitation center services available in different, it's not like everywhere, but the government has set up certain nutritional rehabilitation centers. In Vishakhapatnam, we have in our King George Hospital in the pediatric, besides the pediatrics, what we have the NRC, where the children who are underweight, this marasmic child, they are referred from Anganwadi centers to KGH, like in and around Vizag, all the children would be coming up there. Okay, so there the mother, they have to stay till the child would be attaining the optimum weight. So mother, she will be given counseling, how to cook food, what kinds of food to give. So everything, there will be a food counselor, there will be a nutritionist, so there will be a pediatrician and a medical officer. So they will be taking care of all the children. So the mothers also would be given counseling and how to take care of the child. Everything will be taught to them, and even money also will be given to the mother, like they are staying like all that days, right? So there may be there may be loss of daily wages for them. So they will also be providing certain optimum amount for each day while they stay there in the NRC. And hospital treatment, definitely if the child is very uh, cannot cope up, like completely he is land up in some infection or anything, the hospital treatment also has to be given along with the treatment of malnutrition. And follow up care, so just leaving the child after losing gaining up the weight is not sufficient. You have to follow up. So when the child has received optimum weight, so you have to again follow up. You have to send that child back to the Anganwadi center. You have to tell them like what, how you have to again monitor the child weight regularly till 5 years of age, or whatever, depending upon the family conditions and everything. There should be follow up of the child, so that the child again may not land up in malnutrition. Okay, so these are the different hmm, aspects of malnutrition. It's a very, very common problem prevalent in the world and in our country as well. So, as community medicine students, you have to be having a very broad knowledge about malnutrition, its prevention measures, okay, and its epidemiology, like what are the causes to deal with this. So when you know the causes, you can suggest the preventive measures. So this is about malnutrition. Okay, thank you.